Hello and welcome to today's Expert Chat at Understood. I'm Julie from the Understood team, and our topic today is questions to ask your doctor about ADHD medication. Our expert today is the wonderful Tom Brown, who is Understood's in-house psychologist. He's also the Clinical Associate Professor of Psychiatry and Behavioral Sciences at USC's Keck School of Medicine. How are you doing today, Tom?
Doing okay, Julie. Happy to be here with you.
Well, we're thrilled to have you here. This is a big topic, ADHD medication. A lot of our parents have questions about it, and one of the big questions is, should my child start taking ADHD medication? So I think as we dive in, I want to mention to the parents who are joining us to please share your questions in the chat box. Feel free to introduce yourself, where you're from, and just start putting in your questions. But we'll start off with a big question, which is, how does ADHD medication work, and does it work for all kids?
Okay, the second part of the question I can answer easily, and it works for most kids who have ADHD. I usually say that about 8 out of 10 people who have ADHD, little kids, teenagers, and adults, find that if it really is ADHD, that this kind of the medicines that we have available are helpful. For some, it's huge how much it helps them. For others, it's substantial, but it's not huge. For others, it helps a little bit, but not that much. And 2 out of 10, the ones that we use the most, the stimulant medications, we use them the most because we've had them the longest and we've got the most research on them, and they usually work the best. 2 out of 10, they don't work, and we do have some non-stimulant medicines that also work. But the other thing I'd say is ADHD medicines cure nothing. It's not like you have a strep throat, you take an antibiotic, and it knocks out the infection. It's more like eyeglasses. That I have a problem with my eyes. I can't read typewriter-sized print without my glasses. If I put these on, I can read it about as well as anybody can. If I take them off, I'm right back where I started. The glasses do not fix my eyes. Medications do not cure ADHD. However, for 8 out of 10 people who have ADHD, the medicines, if they are properly tuned to the individual, can significantly improve the situation during that part of the day when the medicine's actually working.
Okay, so let's pause there. You just gave us a bunch of information, including, you mentioned there's a couple different kinds of ADHD medication. Maybe it would be great if, I know you helped Understood on a terrific article that's an infographic that explains how ADHD medication works, and we're going to share that link in the chat box with parents. But if you could walk us through, what is it about ADHD that affects brain chemistry? How does the medication help with ADHD?
The brain carries messages with chemicals. And what we've learned from the study about brain functioning in people with ADHD is that often the chemicals which are important for the management system of the brain don't get communicated from one part of the brain to another as effectively as they are for most other people. Now, this diagram that you can see, I'd call your attention to the circle that you see to the right, which is a little takeout from the connection between two neurons. Now, you have to understand, in the brain there are 100 billion neurons. These are tiny, tiny cells you can only see with a very powerful microscope. But the communication between them is with low voltage electrical impulses. So the brain is like this huge electrical system, all packed into a small space. It's got all kinds of little subsystems that have to talk to each other, constantly get anything done. And the way they do it is the release of neurotransmitter chemicals. The reason they need that is these are not wired together. And that's not just for people with ADHD. These communication cells, the networks that carry these messages, are not wired together for any of us. And so when a message is going from one part of the brain to another, or from one set of neurons to another, it travels down. And now if you look at the circle, you can see on the top of the circle, you can see those little circles that have the little green shapes in them. And what it's showing you is that when the electrical impulse comes, it releases microdots of that chemical. And you can see the little microdots falling down and connecting on the other side, the bottom side of the circle, and you can see the 3 receptors sitting up, and there are a lot more than just a few places where it's being released from, and there are a lot more than just a few. These are just examples of the receptors.
And this happens for every person, whether you have ADHD or not.
This is the way it works for everybody. And so what happens is you get the electrical message comes, it gets released, it causes the release of microdots of the chemical that crosses that little tiny gap, thinner than a piece of tissue paper. And if it hits enough of those receptors soon enough, message goes right over to the other side, and then eventually travels down the network to be able to get to wherever it's got to go in order to do what needs to be done. And then there's one more thing you need to know about that. You don't see it on this picture, but it's mentioned down below that, and that is also on the sending side, which is at the top in this little circle. You see where you see the release, but there are also some other cells there that don't show up in the diagram. Those work like little vacuum cleaners. Those are called transporters. And what they do is after the chemical has been released, they go and suck it back in and reload the system just in fractions of a second. This whole thing works in thousandths of a second. In 1,000th of a second, you can get 12 messages across. It's very, very fast, faster than any computer.
Wow.
And so what's the question then is, if you have ADHD, how is it different from the way it is for anybody else? And what we know about it is, with people who have ADHD, their brains make these chemicals same way everybody else's brain does. They simply do not release and reload them effectively. And that's where the medication comes in. For the 8 out of 10 people who have ADHD, who have this difficulty where the chemicals are not releasing and reloading effectively in the management system, medicine helps to improve that communication.
That's great.
Part of it is slowing down that suck it up thing, so that they have a little longer to sit on the more fractions of a second to sit on the receptor so the message can get through. Because you know what's interesting about this is that for messages about things, somebody who really is interested in something or is really scared about something that might be happening, you get a really good release, an enhanced release of those molecules of the transmitter chemical that help carry the message across. If it's something that's not that interesting, people with ADHD often don't get as strong a signal across, and as a result, a lot of things get neglected.
And that actually helps explain something that a lot of parents are confused by, which is, why can my son pay attention sometimes, like to a video game, for example, but sitting down and getting through math homework is such so difficult?
Yeah, that's what I refer to as the central mystery of ADHD. The mystery is, why is it that anybody who has ADHD has a few activities in which they can focus and remember and work steadily and avoid distractions just as well as anybody else can, even though in almost everything else they've got to do, they have a lot of trouble with it. Mm-hmm. Typically, if you ask them about it, they'll say, when you say, why can you focus on this and not on that, on your sport or on your video game or on your art or your mechanics, and not on these assignments that need to be done, what they'll say is, it's easy. Mm-hmm. If it's something I'm interested in, I can pay attention. If not, I can't. Mm-hmm. And most people then say, oh, congratulations. That's true for anybody. Anybody's going to pay attention better for something they're interested in than for something they're not, which is true. But here's the difference. People who have ADHD, they are able to focus well on those things that they're really interested in, or if they're afraid something very unpleasant is going to happen fast, and they don't take care of this right here, right now. But the problem is, it is not under voluntary control. And that's where the difficulty lies. And that's what the medicine can help for 8 out of 10 people.
So the medicine can help in terms of releasing enough of the brain chemicals, helping them make it across that little gap, and helping the receptors pass the signal along. To make the connection so the messages get through more effectively. Yes, that's what they do. So does the medicine start working right away? Would a child, with an hour or a day, or how long does it take to... The medicines we use for ADHD, the stimulant medicines that we work we use most with ADHD, work right away when you've got the right dose for that person.
But the thing that's important to know about this, and some prescribers don't even have a clear understanding of it, is the dose, the size of the dose that's needed for stimulant medication for ADHD has nothing to do with how old you are, how much you weigh, or how severe your symptoms are. It's how sensitive is your body to it. I see little kids, I see teenagers, I see adults. Most of the little kids are taking very small doses. But there are a few of them, just as small as all the rest of them. We've got to go to the top of the adult dosing range to touch them. Even though for most other kids of the same age, that would be way too much. So, among the adults I see, most of them are taking fairly hefty doses. There are a few of them just as fat as I am and taller than I am, where they're taking no more than you give a typical 5-year-old. It needs to be tailored. The size of the dose and the timing of it has to be tailored to the individual person.
So that's a really important point. I know you've written some articles for us on that exact topic. What do you recommend if parents are concerned that they're not sure their child has the right dose? What questions do you recommend they go to their child's doctor with? What questions to ask?
Well, I think the one question that they might ask is, could you take a look at what I've written down about the times we notice when the medicine kicks in and when it seems to wear off? Because often you read descriptions of medicine that say, oh, this medicine lasts for 12 or for 14 hours or for 8 hours or 4 hours or 6 hours. And then sometimes people assume that that's the way it is for everybody. And the fact is, different people have different rates at which they metabolize these medicines. And sometimes a kid is taking a dose of medicine in the morning, which is supposed to last for the full school day, and it wears off shortly after lunchtime or even before lunch. While there's some other people taking the same dose of the same medicine who are the same age, where it doesn't wear off until 2 or 3 hours after school's finished or until supper time. So you want to tell the doctor about when it seems to kick in and when it seems to wear off. And if there's a difference in terms of how well it's working for the various things that need to be done. So it's not just how is it at 10 o'clock in the morning, but how is it at 2 in the afternoon and at 4 o'clock in the afternoon and at 7 o'clock at night if they're doing homework at night. So getting some sense of when that happens or if there's side effects, to be able to ask about them and see if there's a pattern to it that the prescriber can help you figure out whether there's a way of working it out.
And so maybe for parents to maybe jot down, keep some notes so that when you go to the doctor, you'll have some specifics.
It's a big help because if you don't get it specific, it's hard for the physician or whoever the prescriber is to be able to make sense of what to do about it.
Okay. We've gotten a couple questions from parents. Thank you, and I encourage you all to ask more. The first question is, will medication help with my child's motivation to learn?
If it works, you should see a difference in motivation. Because one of the things that we're looking for here is, first of all, it's not magical. We have no medicine which you can give to somebody which will make them love to do their homework or which will make them focus on whatever the specific task is you want them to do, take out the garbage or make their bed. What we have are these medicines which, when they work, the 8 out of 10 times when they work, for 8 out of 10 for the 8 out of 10 people for whom they work, when the dose is right and it's working for that person, then they usually will report that they feel more motivated to do, more alert, better able to focus, better able to sustain effort on things. I've had a few kids who will report back, this is helping me focus much better on my video games. And
okay.
In that situation, I have to say, well, I don't have anything which will force you to not turn on your video games when you're supposed to be doing your homework. So it's a matter of talking with the person to get them to plan for when this is working and then try to organize the task that they have to do so that they can take advantage of the benefits of the medicine. If it's not making any difference in motivation, there's a good chance the dose is not right or it's just not a good medicine for that particular person. They might want to consider something else. But keep in mind, when you're evaluating the effects of medicine, you've got to think about it in the time frame that medication is working, when it kicks in and when it wears off, and evaluate during that period. It is not going to be doing anything before it's had a chance to get started. Some of the medicines kick in quickly in about 20 to 30 minutes, and there are others where it takes an hour or an hour and a half before they kick in.
Okay. And we've gotten a couple questions about side effects. We'll start with the broader question first, which is, what are the potential side effects and withdrawal issues with these medications?
Okay, the side effects that we most commonly see with stimulants, I'm talking most about those because those are the ones we use most frequently, and they usually work the best. The most common things when you start up are maybe a little headache, little stomach ache. Usually that doesn't last long. A lot of people don't even get it. It often will make a person not too hungry for lunch if they're taking it in the morning. Generally, that goes away within a matter of a few weeks of being on the medicine. Once in a while, we'll get somebody where it continues to be a problem, and you've got to work hard to figure out ways of getting enough nutrition in them.
So that's even when you've got the right dose?
Even when you've got the right dose. There are just some people where their appetite is diminished considerably by the medicine, but most people will have a little downturning of their appetite for lunch. And it doesn't usually affect breakfast because it doesn't kick in that fast. But it certainly can make you feel like you only about half the lunch you'd normally eat. Usually the appetite comes back in time for dinner. Or sometimes, depending on how fast the person's metabolizing and which dosing or what kind of distribution system they've got in that medicine, they may be picking at their dinner, and then about 2 hours later, after you've got the kitchen cleaned up, they're going to want to look for another dinner. But the appetite thing is one that usually fixes itself within a matter of a few weeks. It's just important to be flexible about when you get the food in. And if you can get them to eat a decent breakfast, that's a help.
Okay.
And also late night snacks. The one other thing that often happens with these medicines when they're first starting is if you give it too close to bedtime, it can keep the person up. The answer to that, of course, is don't give it too close to bedtime. However, the thing that's peculiar about it is I've had a few people, not many, but a few people where they have a lot of trouble getting to sleep. It's like they can't shut their head off. And for them, if they take the medicine close to bedtime, it helps them focus on going to sleep.
That's interesting.
So I have no way of knowing who's who on that. It's a trial and error thing, but that's one of the things that can happen.
What about for teenagers who have a lot of homework they need to do in the evening?
60% of the patients I see who are taking all-day medicines, so-called all-day medicines for ADHD, need a booster dose to help them with homework. Because usually those medicines you take first thing in the morning are shot by 2, 3, 4 o'clock in the afternoon. And many kids have homework in the evening, either because that's just when they get around to it, or they've got sports or some other after-school activities. Or sometimes they just got a lot of homework. And so the typical strategy for that is to use the long-acting medicine to get them through the school day, and then to use a short-acting dose of the same kind of medicine to help the person be able to get coverage for late afternoon, early evening. And the tricky balancing act there is you've got to watch the timing so that you don't kill the appetite for dinner, and so that you also don't keep them up too late. But usually with trial and error over a few days, it's usually possible to get that figured out so that it's a manageable way to combine it.
Okay. We got a question. A parent is asking about a 7-year-old who takes ADHD medication in the morning before school. He's taken it for a year and has had minimal side effects. And this parent says that the one thing that she does notice is that the medicine seems to make him very reserved. She says he'll interact, but you have to work at engaging him. She's asking if that seems like a typical, I don't know if you call it a side effect, a typical effect for a child who's not normally reserved to suddenly be very reserved and sounds like needs to be drawn out.
Yeah. Sometimes there are two ways of thinking about that. One is that there are some kids who have ADHD who are wildly hyperactive and always talking and like whirling dervishes, and when they get just a normalizing dose of medication, they're more like regular kids, but they're still quite active and still the regular self. It can be a big difference when you first try the medicine, but if it's something where this particular kid seems to be losing some of his spontaneity. It doesn't seem to have the same sense of humor. It doesn't seem to be as inactive. Seems as active and interactive with other people. Doesn't feel much like talking. usually that's an indication the dose is too high. Or it may not be a good medicine for that particular person. That's what we call blunting of affect. And when I talk with kids about it, just so if you're getting dorky, where you just get too serious and everything is serious and you don't have your usual sense of humor, you don't feel much like talking with people, chances are we've got the dose too high or it's not a good medicine for you, because you ought to be able to be your regular self when you're on the medicine. However, if your regular self is way too hyper, then you may not want to be fully your regular self in that during that period of time you're trying to work. So it's a matter of adjusting it to the individual.
Let me ask a question. That this parent didn't include this, but she said her son, 7 years old, has been taking it for about a year, and sounds like at the same dose over that period of time. This just reminds me of a question we often get in understood community groups, which is as kids grow, might the medicine have more or less of an effect as kids' bodies are growing and changing?
Yeah, and it could be more or less. Many times people figure, well, the kid's getting bigger, we've got to increase the dose. But that's not always the way it works. Sometimes as they get older, they need less. And sometimes they need a little more. It's not unusual to have to make some adjustments for that, but it's a matter then of the prescriber taking some time to talk with the kid and with the parents and find out how the medicine's affecting them at different times of the day. And if they're just first starting with the medicine, it's not unusual to have the experience of, oh, this is a lot better, and then after 2 or 3 days, it doesn't seem to be doing much. Usually what that means is you're almost at the right dose, but not quite yet. But if a person has something that's been working for them, and then maybe they've been on it for many months or even several years, and it just doesn't seem to be doing much anymore, the first thing to ask is it the same medicine? Because once in a while, a generic has been substituted at the pharmacy, or a new generic has been substituted for a generic that was working pretty well. And we had that, for example, with the Concerta, the long-acting version. There were 3 manufacturers, and 2 of them were selling a generic for Concerta, which was not equivalent to Concerta.
That's
and the FDA posted a notice about it and told them to get it off the market or change the medicine. And so far as I know, they haven't done either one. There was one brand that was good. So sometimes if it's not working, it may be there's been a difference in the brand, or they may have switched from brand to generic, or from one generic to another. So that may be something to do. But the other thing is, sometimes as a person gets a little older, their body chemistry changes, and it may be that the dose is too high, or it may be that it's a little too low. And so you often have to tweak it a little bit one way or the other. But we don't usually see a constantly escalating need for increasing doses. Okay. If we did, we'd have big problems with that. But the fact is, for most people, the doses, you may have to take it up a little bit more, or bring it down a little bit. But usually the changes are relatively minor. And it's just a matter of trying to find that sweet spot between too little and too much. If you have too little, it doesn't do a damn thing. You might just as well be taking breath mints. And if you're getting too much, then you begin to feel like way too serious, or wired like you've had way too many cups of coffee. And in that case, you need to make some adjustments.
Well, that's really helpful. We've gotten a couple more questions, but before we move on to them, I want to ask one more follow-up related to this mom of the 7-year-old. So you just had some great comments about trying to make sure that the dose is right, might be needing a little less or a little more. My question is, when parents go to, if it's their pediatrician or whoever their prescriber is, what can parents do to try to make sure that their doctor has enough experience in terms of knowing how to fine-tune that dosage?
I guess it's a matter of 2 things. One is see what you notice about, for example, if a physician or any prescriber is saying, oh, this kid weighs so many pounds or so many kilos, and therefore this should be the dose. On stimulants, that's not how you prescribe these medicines. Okay. And so they could say, you don't want to ruffle the doc's feathers, but you might want to say, well, we heard from reputable sources that this doesn't follow the milligram per kilo formulas that you get on some other medicines, that it's more individual. Or you can try what they're suggesting and see how it works. But if what they're suggesting is starting out up on anything other than a baby-sized dose, it's probably not a good idea. And you might need to question that. And if you've got a doctor who doesn't seem to want to take any time to talk about how it's working or what the side effects are, ask about it, question it. If that doesn't, if you can't get a reasonable response, get another doctor.
Okay. We got a question from another parent who asked, what if my child doesn't want to take medication on the weekends? I understand that he might not need it as much because he's not in school, but it kind of ruins his routine.
Well, first of all, it used to be that people worried about kids taking the medicine because there was a fear that it would stunt the kid's growth if they took it regularly. And we're now pretty sure that that doesn't happen. There are a few kids who are really slow in their growth curve, where the main thing is you've got to be sure they get enough to eat. And that's where the trouble comes in. But kids who are on these medicines usually attain their full height over the course of their growing up. There may be a slight delay, but it's not a huge difference for most kids, although once in a while you'll get a rare exception on that. But on the basis of that worry, they used to say, well, you could give them a break from the medicine on weekends or on school vacations. And that certainly is still something we do if you've got a kid who's just got ongoing difficulties with not being able to eat enough when they're taking that kind of medicine. However, the other thing to consider is that for some people, their ADHD symptoms just impact them on school stuff. And if they're not either in school or doing homework, they don't much need it. There's some other people, kids and adults alike, where the medicines really help a lot with their interacting with other members of the family and with their interacting with friends and with their maintaining their daily life. And so in a case where you've got somebody where it's helping a lot, it's probably a good idea to have them take the medicine 7 days a week and during the vacation periods. However, if you've got somebody where they're having a hard time eating enough to be able to maintain body weight or something like that, often we will have the patients stop taking the medicine on days they don't absolutely have to have it. However, with these medicines, unlike some other medicines, for example, antidepressants, and some of the other types of medicines that are used for ADHD, that are used for different things than ADHD, you've got to maintain a blood level. You know, there's a certain amount of the medicine that needs to be in there, and if you drop the level by skipping doses for a few days or a week or so, the person's going to really feel it, and they won't have the benefits of the medication. This is not true for the stimulant medications that we use most for ADHD. We're not maintaining a blood level. What you take today is pretty much gone tomorrow morning, and if not before. But nevertheless, for some people, it's still a good thing for them to take the medicines 7 days a week. I usually ask patients to take it 7 days a week at the beginning so that the patient and the family can clearly see how the medicine works with all the different activities they engage in, and then make a decision once we find we've got an effective dose, then to see if it's something where it makes sense to take it just for school and for homework, or whether it's something that's going to be helpful for a lot of other things, in which case it's probably a good idea to do it 7 days a week.
Okay. That's very interesting and actually segues into our last question, which is from LA Mama. She says, my child also has anxiety, and the anxiety is much worse than the ADHD. And she wants to know, can ADHD and anxiety medications, can they work together?
They certainly can work together. Generally, when we're looking at a kid who has a lot of anxiety and a lot of ADHD, the question is which one's causing the most trouble right now? And then you go for those things. And sometimes the anxiety can be dealt with in psychotherapy or cognitive behavioral treatment, but sometimes we need medicine for it. Usually we'll use SSRI medications that can be sort of in the person's body on an ongoing basis and reduce the anxiety. However, it's also true that people vary. People who have a lot of trouble with anxiety vary in terms of how stimulants affect them for their anxiety. There's a recent meta-analysis where they looked at a whole bunch of studies, and they blew apart a myth that has been around for a long time, saying, oh, if you give somebody stimulant medicines, it's going to jack up their anxiety and it's going to make it worse. And what they found was, in some cases, that is absolutely true. But most of the research studies that have been done on it do not support that assumption. And the reality is that there are some people where when you get them on a stimulant medication that's balanced and right for them, their experience is they feel less anxious on it than they did before they were on that stimulant medication. However, it is certainly true that there are some people where one or another of the medications that is used for ADD may increase their anxiety, and sometimes it increases it to the point where you need to try a different medicine to deal with the anxiety if it's a big problem for them to begin with, or you certainly would want to consider the possibility of trying a different medication that may, for example, a non-stimulant medication. It doesn't cure anxiety, but it might, in fact, not exacerbate it. Sometimes stimulants stir up and increase anxiety for people who have it, even though they may be helping with the ADHD, but sometimes they help to relieve it.
Okay, well, I think this has been a terrific conversation, Tom. I want to tell all the parents who've been watching that Tom has mentioned stimulants, non-stimulants. He described how ADHD affects brain signals passing from one cell to another. We do have this nice article that Tom helped us with. It's called At a Glance, How ADHD Medication Works. So I encourage you all to check that out. We also have some pieces Tom helped us with about questions to ask your doctor about fine-tuning your child's medication. So there's a lot of great resources on Understood. This chat will also be archived soon, so you can watch it again if you'd like. And we also invite parents to check out our upcoming events by going to u.org/calendar. And Tom, we look forward to our next chat with you. Today's been terrific. Thank you so much.
Okay. Thanks very much.
Have a
Take
great
care.
day.